Good morning. My name is Mike Cirillo. I'm the president of myMatrixx and Express Scripts Company. I want to welcome and thank you for attending the virtual 2020 Express Scripts Outcomes Summer Series. Outcomes is an Express Scripts event. It's built to showcase new challenges, new products, new solutions, and really present a forum to be able to have a dialogue as a means to enable us to simplify healthcare, reduce costs, and drive better results for our members and, more importantly, our injured workers. Last year marked our first appearance at Outcomes, and while held under very different circumstances, we're thrilled to participate again. For 2020, we've assembled what I think is an exceptional panel to explore the intersection of COVID-19 and workforce health. Like every industry, the COVID pandemic has forced us all to change. We've changed our lives, we've changed our business practices, and in order to still deliver care for our families, our employees, and our clients, and our injured workers. One of the biggest questions in work comp today is, how do our clients handle COVID-related claims? Determining when COVID-19 infections covered under workers' compensation law, what the appropriate treatments are, and how to minimize the risk of infection among workforces are issues that simply didn't exist months ago, but now are come to the forefront of the sector. To answer those questions, I'm going to turn it over to Phil Walls, our Chief Clinical Officer, to delve further into the topic, as well as to introduce our esteemed panel. Phil's been working on this for a long time, trying to make sure that we have a strategy for a long-term approach to this to benefit all parties involved. Phil, why don't you take it from here?
Thank you, Mike. And first of all, welcome to our audience. We sincerely appreciate you joining us this morning. And it is my sincere pleasure to introduce our panelists. Most of the individuals that are with us today I have known for years. It is an impressive lineup of panelists. And I want to do something a little bit different. You know, oftentimes at a presentation, we hear the usual information that's in a bio. Well, I've talked to each of our panelists and asked them if I could share some personal information, and they were all very willing to do that. And of course, I'll go through their credentials, but I find some of the personal information that they share to be even more impressive than the credentials themselves. So first of all, we have Dr. Teresa Bartlett. Dr. Bartlett is Managing Director and Senior Medical Officer at Sedgwick. And Teresa and her husband last year had the opportunity to hike the Camino de Santiago. Now, if you're not familiar with that, I encourage you to Google it. Basically, it is the way of St. James, and it is a 500-mile trek from France all the way into Santiago, Spain. Quite an impressive accomplishment. Next, we have Tammy Evans. Tammy is the Assistant Vice President and Director of Workers' Comp Claims at EMC Insurance. And I know she is very proud that her son graduated pharmacy school this year. He has earned his PharmD, and that's even more meaningful to the folks at myMatrixx, and that he had the opportunity to come to our headquarters in Tampa last year and actually shadow our Director of Clinical Pharmacy, Michael Wynn. So again, congratulations, Tammy. Then next up, we have Alice Leo. Alice is President and CEO of QualLinks. And Alice shared with me that she is extremely proud of her two daughters. One is a nurse, the other is a social worker. Interestingly enough, from my perspective, they both have significant training in pharmacology and pharmaceuticals. They have reached that point in their life where they are now starting to give advice to their mom. And I think Alice shared with me that that is an extremely interesting and rewarding dynamic to see. So again, congratulations, Alice. Next up, we have John Rooser. John and I have had the privilege to be on stage together many times now, and many of you know John. He is President and CEO of WCRI. But in spite of having known John for a period of time now, he shared with me something I had no idea, and that is that he has been a ham radio operator for the past 30 years. And I think the COVID-19 and the stay-at-home orders has given him an opportunity to reach out to folks around the world during this time. And he has actually been able to use something that he's very proud of. He's making contact with people around the world using something, a new weak signals node that was developed actually by a Nobel Prize winner at Princeton, which is even more significant to John because his undergraduate alma mater is Princeton. In addition to that, if that's not enough, he's also renovating a condo in San Juan, Puerto Rico. And of course, he's looking forward to the time when he can travel there again once we get past all of this. And then last but not least, we have Dave Weiner. Dave is Managing Director of Ostroff Associates. In addition to that, he's the former CEO of the New York State Insurance Fund, as well as the former chairman of the New York Workers' Compensation Board. Now, as if that's not impressive enough, Dave is also president of Kids Chance New York, as we all know, a very significant and important program. So Dave, thank you very much for your commitment to that program and also for joining us. Thank all of you for joining us this morning. We're going to talk, obviously, about presumption today in workers' compensation. A little bit of background on this for myself personally. Years ago, in fact, over a decade, the first time presumption really made my radar, I was talking to a medical director in Pennsylvania, and I asked her, as I oftentimes do to different individuals in the industry, what keeps you awake at night regarding workers' compensation? She didn't even hesitate. The first thing that she stated to me was cancer presumption. Like I said, that's when that really made my radar. She went on to explain that the cost with chemotherapy and taking care of cancer patients, the variations in state law on how they approached presumption, both in who was covered, the population, as well as what was covered, the type of cancer, was so varied that just was introducing risk that was very, very significant to her own company that she was working for at the time. Ever since then, I have really focused on presumption, cardiac presumption, cancer presumption, and now, of course, we're looking at COVID-19 presumption. So with that background, I'm going to pose a question to the audience. And, you know, if we weren't in the middle of the pandemic, we would be having a face-to-face discussion today. And those of you that know me know that I love to interact with the audience. So we're going to attempt to do that in a virtual setting today. In just a moment, I'm going to hand the controls over to our producer, and we're going to bring up a whiteboard to give each of you an opportunity to answer a simple question. When or how has presumption impacted your business? It can be any type of presumption. It can be any comments you want to make, but this will give you a chance to interact with myself and the panel today, and it'll also give us an idea to know what to focus on as we're talking through this and answering some of these questions. So as I said, I'm handing it over to the producer.
On your screen, you will see the whiteboard for today's meeting. You do have the ability to annotate or write on this whiteboard. On the left is a set of icons, and we will be using the text icon today. It has a big and small uppercase T. If you select that icon, you can begin typing on the whiteboard. Once you click out of the text box, your information will appear on the whiteboard. So if you would like to go ahead and begin that.
So we'll give folks a moment to be thinking about that. You know, as I stated years ago in being introduced to cancer presumption and also cardiac presumption, as a pharmacist, this introduced medications that were very, very different from what I had encountered in workers' compensation prior to that. We moved out of the pain management, the antidepressants, the anti-seizure medications, and into the realm of cardiac drugs, chemotherapy. A big change there was that with a lot of the classes that we see in workers' compensation, we're not so concerned about compliance. Then all of a sudden we start treating people with cardiac meds, and compliance is vital. It really introduced that whole area of compliance to our team of clinical pharmacists. I see a comment that it hasn't impacted the business yet, but there is some worry there. Waiting to learn how it will impact us. So definitely a reason for attending today is to find out what our panelists have to say. Interesting. It has resulted in a lot of claims, very significant response. And I know that a lot of people have already been asking me about that. I know I saw the news release the other day about the number of cases that California is reporting. Cindy, interested in how it's impacting others? Another attendee, haven't seen many claims, but concerned about the first responder presumptions. Somebody in California, that's also covered under the Longshore Act as well. Very interesting comments. So I think the takeaway I have is that there's a lot of interest. Here's another one: water district employees don't deal with presumption. And then the last part is cutoff. I don't know if our producer can rearrange that or not so that I can read it all. So there's definitely interest. I think there's concern. And my key takeaway from this is that the audience today is looking to see what they can learn from our panelists. So panelists, it's up to us. So I'm going to go back to our panelists now and begin our discussion. We've talked a little bit about history and impact, and I want to let the audience know that the Sedgwick Institute has recently published a paper entitled American Workers' Compensation, a study in the disparities and the expanded use of presumption. So based on that, my first question is to Teresa. Dr. Bartlett, if you can comment on the title of that paper, and especially what is meant by the disparities.
Of the paper, I can only guess, but my sense is what they mean by the disparities is how each state that has presumption does it differently. So, for example, in some states, you have the preponderance on the employee to prove that they were actually exposed or that they actually came upon their illness through the workplace. And then in other states, just being in a specific job class renders you presumed that it was workers' compensation under the law. So I believe that's what our authors meant by the disparity, because there's a huge disparity between how it's handled state by state.
I agree. I think that was one of the first things I noticed when I started talking about this. With COVID, of course, we're changing the attention in many cases from first responders to essential workers, which in my mind means we've moved it to a much larger population. And I'm wondering, with this change, do you think that the approach to COVID in some ways is going to sort of move the dial to broader application of presumption in the future?
I do, and this has added a ton of confusion, if you will. I mean, we literally have tens of thousands of claims right now for COVID-19. And what has happened is, what is an essential worker? You know, it was really designed by each governor on what would be determined as essential worker. And I bet most of you on the phone and here my co-panelists could have been deemed an essential worker. If you needed to go into an office, I bet a lot of our companies went through the process of becoming essential. And not to argue that we're not essential, but when I think about essential, I think about first responders, I think about healthcare workers, I think about those that need to get supplies to those workers and food. But right now, it's pretty much any of the retail industry that has had to remain open and service the public. So it's a very broad net that we've cast, so to speak. And so when you think about essential workers, we're seeing a lot of claims where an individual may come down with symptoms and they're reporting a claim just because I don't know if I need to or not, but I was exposed to someone who is exposed to this, who is exposed, and I just want it on the record. So there's a lot of that kind of claim reporting going on, and I would just say that the burden of proof being what it is between the various states has placed a lot of noise in the system. And the other thing is that we're dealing with a very communicable virus. And the fact that we don't have control in the workplace of where our workers are going how would we know where they got it? Other than if you have a nurse who's directly exposed to aerosolization in treating someone with COVID-19. So, it's very, very tenuous. It's a tough situation right now.
Thank you for that, and very, very good insight. If we could stay on the same lines for just a moment. And of course, we've already started down this path, but are there alternatives that could have been utilized instead of presumption, in your opinion?
There are always alternatives. I think, I really think that it's helpful in workers' comp that individuals can thoroughly investigate, claim, and all the details. And I think presumption, especially if the burden of proof is on the employer, I think presumption takes a lot of that out of the equation and makes it an automatic. And so I think that there could have been more defined ways to include it, very specific language that and industries that may have been helpful, but Monday morning quarterbacking.
Yes, I understand. And along those lines, when we start talking about definition, I'm going to change the attention now to Dave Weiner with his experience and as part of making regulations like this. So, Dave, if a state makes a change to the way it handles presumption, COVID-19 or otherwise, who makes that change, and how do they decide the scope of workers covered, as Teresa was just talking about?
Well, Phil, normally it's a mix in states. In the case of presumption, the change mostly was made through executive order or regulation because, as many of folks know, the legislatures were recessed during COVID period. So it really kind of forced the hand of the executive branch to make an executive order or a regulation. As both you and Teresa mentioned, traditionally the focus was on first responders. Many feel the genesis of this was post 9/11. Mainly New York City police and fire, who developed pulmonary diseases and cancers. In this case, it ranges from first responders to frontline workers, and as Teresa mentioned, essential employees. What is that essential employee? Presumption is obviously a politically sensitive issue and very much politically charged issue, and many times looked at through a moral and emotional lens. Presumption is a cost driver, but how do you say no?
Yes, for sure. And to that point, to what extent, in your opinion, is the burden of proof now shifted from the worker to the payer?
On the burden of proof, that's what presumption is. That's what it does. That's what Teresa mentioned. It shifts the burden of proof from the claimant to the employer by creating a presumption of causation in favor of the employee. Many of the states feel that this should be taken out of their hands. Congress has introduced a Pandemic Heroes Compensation Act, which is modeled after the 9/11 Victims Compensation Fund. There's other states that feel as though they're equipped to handle these cases. This is why the workers' comp system is set up. Many regulators have said to me, this is what we do. So essentially, I think going forward is going to be an issue of cost shifting back and forth.
But the extent with states that adopt presumption is basically 100% in terms of the shift.
Correct.
All right. I want to turn our attention now, and let's start talking. I just mentioned the states that have adopted it. Let's start talking about which states have done that. One of our panelists, Dr. John Ruscher with WCRI, of course, he has a wealth of data in this regard. And so, John, I'm going to direct my next question to you. And simply put, that is, which states are considering presumption and which ones have already implemented?
So, as Dr. Bartlett and Dave Weiner have already said, there actually is disparity across the different states. So there are 15 states that have either executive orders, mainly executive orders, or laws that create a presumption that shifted the burden of proof to the worker to presume that in fact they contracted COVID at work. However, there are many states where have not done anything. So particularly in the South and also throughout the West, those states are relying on their traditional workers' compensation systems to handle COVID claims. And you do see some COVID claims in those states as well. And then there's a group of states that are in the middle. They're trying to do something. They haven't made it yet. A lot of those are in the New England and Mid-Atlantic, as well as the Carolinas and Ohio. They are states where there is a bill sitting in the legislature but hasn't made it all the way through yet.
Good. Thank you. My next question is going to be directed at Tammy Evans and Alice Leo. And it's not by accident, but actually by design that I'm talking to an individual representing a carrier, Tammy Evans, and another individual in addition to Dr. Bartlett, representing a TPA, which of course is Alice Leo. So Tammy, I'll direct the next question to you. Based on John's comments, there's a lot of moving parts here. How is your adjusting staff keeping up with all of these changes?
Thanks, Bill. And I think what John just talked about is exactly why it's been a real challenge for us. But I'm really proud of how our team has responded. Not only do they have personal and family issues to deal with through this, but they also continue to handle their full-time jobs. And one of the great benefits of our work comp system is that it's jurisdiction specific, which allows each jurisdiction to determine their own statutes and regulations. But what makes a great system can also make it difficult because we have to maneuver through all these different jurisdictions, all their own particular statutes. But especially at the beginning of COVID, there was a large amount of legislative and regulatory activity, keeping up with the constant changes, and what it continues to be is extremely important. There are many resources available to keep up with all the changes, and it continues to happen on a daily basis, basically. For some of our staff, this area of presumption was new. Some jurisdictions were familiar with states that had initiated presumption for cancer or PTSD, but in other areas, it's not something the states or the adjusters were familiar with. So one of the first things we did early on was to break down the types of claims that we would see and make sure our staff understood how to deal with them. We separated them into two different categories, what we consider to be direct claims and indirect claims. And obviously the direct claims were the ones where they were dealing with presumption. And they're still required to do their normal investigation as they would in any claim, but then they had a whole new set of rules to look at as to whether it would be covered under presumption and whether they actually were in a jurisdiction where there was presumption. So they needed to know, did it fall under current statutes, new statutes? Was there a presumptive component? Was it rebuttable? Was it a state where they included positive tests to be part of the statutory? So all kinds of those parts, as you said, that they really needed to understand. Also, that doesn't necessarily fall so much under the presumption, but I think what has been a challenge for our staff too is going with the indirect claims, what we consider those claims that have been affected by COVID. Whether it's they have an existing claim already and medical treatment has been delayed, return to work has been delayed, the employee somehow came in contact with COVID. So those have all been really big challenges for our adjusting staff. But fortunately, we have a lot of internal and external resources that are really helping us work through this.
Excellent. Thank you very much for that. And you highlighted to me what has always been the challenge in workers' compensation, and that is dealing with all the different sets of regulations, all the differences between the states. Alice, I'd like to turn my next question to you, and that is, based on Tammy's response, is this an area where Quallinks is able to assist its client base with dealing with exactly what she just described?
Yes, and I have to mirror Tammy's comments related to how proud I am also of our staff. We pivoted from about a 20% work-at-home group to almost 100%, except for some few essentials. So I'm sure Tammy and her team dealt with the same thing. But more importantly, we were sort of on the tail end of just hearing that the cancer presumption was adopted in New Jersey, which is a large base of our clients. We're also in New Jersey, which is a hotspot. So as Tammy mentioned, her staff had to go from dealing with their own personal issues to now learning about a new virus and learning about how to deal with this potentially compensable virus. So dealing with the personal issues, children at home, sometimes sitting on their laps while they're doing these conference calls, and really trying to bring some really good resources to our clients. We neatly set up weekly calls with our key affected clients, meaning those that had a lot of public entity exposures. Most of the schools closed down. We do handle a lot of schools. Most of New Jersey is in some kind of a pooled fund that we handle. So it sort of made it a little bit easy because they closed, so they weren't having the exposures, fortunately. But the first responders, police, fire, EMTs, and of course we have a heavy healthcare presence as well. So we really had to quickly pivot and gain a lot of knowledge about how to deal with a potential presumption. Presumption was already in place for the first responders, but we had to go from treating a report-only claim as a report-only to now we have to investigate that because we get a lot of exposures, not necessarily positive findings, but our clients wanted to know about those. We had to deal with system revamping for reporting purposes so we could share that information. And again, just the key factor there was doing an early investigation of the potential exposure. Did it happen in work? Was this a key first responder type employee, or was this another type of potential essential? I think Tammy or maybe Teresa mentioned, not all essentials are created equal, right? So we always have to remember that, is the presumption probable, automatic? Is it a possible exposure? So between Tammy's team and our teams, that's the kind of information they're dealing with. How to get that to the client in a way that they understand has been the sort of uphill, I'll say battle to a degree, but learning experience and then a sharing experience. Our employers, our client employers really didn't have any exposure in this area. They were just, again, learning about this presumption for cancer, and now we have this COVID situation. Do I let the police officer and his 20, his or her 20 teams exposure, do they go out, do they stay out of work, or do they come back to work? So that's, the employers, I think, have been the hardest hit with trying to figure all this out. So we've been fortunate. TPAs tend to have a lot of sort of boots on the ground in the local jurisdiction, and they sort of build those relationships. They tend to know those clients personally, and we were able to sort of generate reports and data that can help them make those decisions, as well as really stay in touch with the legal community. Quallinks is owned by a very large insurance company, so I'm able to be part of a legal group that helps us to define what really is going on within each of the jurisdictions we do business. And we're sharing that with our staff and our clients, so everybody sort of has this, real-time learning experience. And I think, and Tammy can probably say the same thing, we're kind of all learning this together at this point, right? And trying to be as sort of, I could say, human as possible, sharing the information and making sure our clients can make the right decisions with care. The biggest part of this, right, is that this is social legislation, and the courts are always going to side with the employee, and we have to always make sure that we can all do that in a way that makes sense for the employer too.
Very good.
So if I may, I might. Oh, sorry. I was just going to weigh in just to add. There's also the perception of each employer. So some employers have adopted HR policies and just automatically paid people and enabled them to be off to heal. But I think the biggest challenge in all this is that a lot of these cases are super gray areas, and I get asked to weigh in, and I'm just thinking about a specific case where someone likely had some exposure at work, but then their wife, who works in the same industry, tested positive the same day or the day before. And so how do we really know, was it the exposure at work or was it the exposure at home? And it's almost impossible to be able to tease that information out when you have a communicable disease like this.
I think, too, if you don't mind me just adding to that point, the presumptions were designed to really recognize that certain employees had a certain risk as compared to other employees. And then along came COVID, and everyone started to, we see the commercials thanking essentials, recognize that in addition to police and medical, there are other types of employees that have more of an exposure. But that doesn't mean all essentials have the same exposure. And to your point, Teresa, it really comes down to that investigation. We have denied claims where we have found out the spouse was tested positively the day or the couple days before. We've accepted others where that has not happened. So it gets murky, but that investigation is very important.
I love the dialogue. I think this is exactly what our audience was hoping to hear. It's very beneficial. Also, just have to quickly comment. I've heard now a couple of times the pride that we're taking in our employees. I'd be remiss if I did not share the same thing from myMatrixx. We're just so proud of the way the workforce mobilized. And it's something that I'm hearing over and over as I talk to clients. And it's something for all of us to be proud of. They are really pulling through for all of us. I'm going to turn our attention now and talk about risk assessment, which is what we're all in the business of. And I think this will be another good opportunity to engage the audience. We're going to do it in a little bit different way this time. The producer in just a moment is going to bring up a polling question. And there's no right or wrong answer. Again, it's just so the panelists can sort of get an idea of what the audience is thinking. And that question is simply, are you in favor of COVID-19 presumption? We're going to give you time to respond to that. And I talked to the producer ahead of time, and I said, we're not giving any more background than that. When we ask someone that, it can come from a business perspective. It can come from a personal perspective. That's entirely up to you. And so we're going to start the timer and give everyone about a minute to respond. And then once we have that, again, we will go over it so that the participants, the panelists know how the audience feels. And then we'll sort of go into more detail on what we're looking at in terms of risk assessment. And I'm going to ask the producer if folks are responding yet.
Yes.
Okay. Just a few more seconds to give everyone a chance. Okay, I think the timing is up. And the results of this, so 6 out of 86 were in favor, 11 no, and 9 undecided. Vast majority did not respond. So what I'm seeing there is that out of the ones who responded, the majority are actually not in favor of COVID-19. So something definitely for us to keep in mind. And Tammy, I'm going to go to you again for the next question. And that is, as we return to the workplace, this is going to be dependent on a number of factors, most of which are outside of a carrier's control. Is there something that EMC is doing for its clients in terms of risk mitigation as the country does start returning to the workplace?
Yeah, sure, Phil, thanks. A few things. First, it's been a challenge in some cases on our ability to get our injured employees back to work. And this can be a result of lots of different things. Maybe there's no work to go back to. There's limited light duty situations compared to what we've had in the past. And I think a big one is a fear of returning to the workplace. How do we handle those employees that maybe there is a job there that they could go back and do, but they, for some reason, one reason or another, have a personal fear of doing that. And we're also looking at the governmental regulations about return to work. Some of the things that are definitely out our control is what the states and local entities are doing in their field. school kind of doing their own thing. So this can be a real challenge. At the claim level, we continue to adhere to our return to work strategy from day one of every claim. The adjuster is working closely, constant communication with both the employer and the injured worker to see if there are some opportunities to get them back to work in a safe environment. And at the client level, we continue to offer resources to our policyholders regarding COVID-19. These resources can assist them in navigating all different things that are going on with the COVID information, what's accurate, what's not accurate. We provide them with the tools they need to prepare and remain open during and to address anything that may be relating to COVID. Our loss control team and claims team work closely together to try and assist our policyholders in whatever it may take to do to keep them open, get them open, get their employees back on the job.
Thank you for that. And Alice, again, the counterpoint from the TPA side, is this the same or different for your clients?
I think it's largely the same. At the end of the day, our initial investigation is going to help drive how that claim is going to be resolved or determined or handled or accepted. We ended up initiating client meetings with our key exposed clients, the ones that had the most exposures, and we developed new areas in our system to capture information all about COVID. Was there a positive exposure? Was there a hospitalization? Did a family member report an exposure? We're not doing contact tracing at this point, but that might be something that will help our clients as well, working with a contact tracing resource. At the end of the day, our clients are very much in the dark, unfortunately, like the rest of the country, really, the rest of the world, in terms of what is the right thing to do, because you don't want to bring someone back to work and then have 5 or 6 other people get sick from it. You don't want to bring, the same argument is with our schools, which in New Jersey, Florida, et cetera, they're all still pretty much closed. And I think Tammy hit it on the head. They're all doing something different. There's no one policy in place from state to state that we've seen. So right now we're going to track all this information, work very closely with the risk and safety resources, our partners that work with these clients, make sure they have all the right information, but really be having those conversations with the employers so they know what their exposures are. Again, if you have a large public entity base, they know what's happening because they're getting those very severe claims, as well as the plethora of exposure claims that really don't amount to a whole lot. That make everybody nervous and make the other employees not want to be around them. So sharing this information, making sure our employees have the most up-to-date knowledge in terms of how this claim should be handled, what should be accepted, what should not be accepted, really working at really one-on-one with these clients, I think, is the key driver there to help them get through this.
Very good. Thank you for that. Teresa, anything unique from a physician's perspective in regard to medical considerations that we haven't touched on yet?
I think it's really important that employers figure out a way to manage the CDC guidelines of social distancing, mask wearing, eliminating crowding, and the most difficult one, I would say, is how will they handle the employee screening each and every day, and so that people are disqualified before they walk into an office with symptoms. And secondly, how do you protect those that maybe have a chronic disease state or they live with someone they're caring for? And so I think it requires a lot of patience by employers and a lot of latitude if an individual can be successful working from home, that we enable that instead of just pushing them, no, you have to come back into an office. But I think, it's a tough HR issue to try to understand, what are the chronic disease issues that might put someone at greater risk, and how do I manage that as an employer? So I would say those are just the big ones. I could go on and on for hours still, but I won't.
Right.
Go ahead. I thought someone else was chiming in. You're absolutely right. We could have done an entire session just about the topic of returning to the workplace. But I agree with you. Those special considerations. Patience was a word that you used. I think that's very important. Not something we always hear from an employment perspective, but that's part of it. This is going to have a lasting effect on the way we do business, all of us. So very interesting. Now, as a pharmacist, I want to turn our attention now to drug therapy. There's a lot of information in the news. I think it's important to distinguish, whether it's talking to people, I've come across this, it's important to distinguish between drugs that are being used to treat symptoms of COVID and then drugs that are being used to actually an attempt to prevent or cure a patient. So with all that, we're really approaching a point, and I'm going to direct my next question to John. We're approaching a point where we don't know completely what the price tag of some of these new therapies are. We've heard things, but much of this is still in development. I was seeing just yesterday considerations to even changing the way patent law is handled because of this. So John, as an economist, what advice can you give the audience? And, is there a way to prepare for something that's seemingly so unknown?
So I might be a bit more of an optimist on this. I think we are learning a lot from the claims data that we're seeing now. So an economist or an actuary is going to approach this problem by assigning probabilities of different outcomes in terms of severity, say, and assigning values for the costs and for the outcomes associated with these different levels of severity. And we are learning a lot about the distribution of severity. And what we know is that, and you've heard this plenty of times, is that most of these cases are actually quite mild. So the California Rating Bureau, for example, estimated that 82% of their claims that they're seeing were mild, and they only had $400 of medical costs associated with them. However, there are, just like in non-COVID claims, a small group of claims that end up being very costly. And so sort of looping back now, Phil, to your question, I think the question for the issue of new drugs is, are they going to be only for those relatively few but very costly claims, or are we talking about a drug that's going to be more widely applicable to, say, the mild cases as well? And I'm not a medical doctor. Unfortunately, there are some on this panel who can talk more about what they think are going to be the chances that a particular therapeutic drug is going to be widely used versus very narrowly used. And as I close, I just wanted to make one other observation. The federal government has taken a role in the support of development of vaccines, but also of therapeutic drugs. And so another question that we do need to consider is whether or not the work comp system would end up covering the cost of those new therapeutics if they get developed, or whether, in fact, they'll be subsidized by the federal government.
That's it. Thank you, John. Very, very helpful. And for the sake of the other panelists, to sort of give them an idea of what's coming up, I'm going to direct my next question to Alice, then Tammy, and then back to Teresa. Dr. Bartlett has shared with me her thoughts about where drug development might go, and I want to make sure we have time to get that in during the hour. So Tammy, or forgive me, Alice, as a TA, if you could sort of share what how you predict presumption is going to impact both your company and your clients.
Well, we're sort of in the brave new world at this point. We already had a presumption in place for first responders, cancer presumption. New Jersey tends to be very, very employee friendly state. And I think that we all have to really keep that in mind that this, again, I said it a little earlier, this is social legislation. So we have to figure it out, meaning it's going to be slanted toward the employee. That's why it was developed. And we have to figure out the best way to manage that. From my company standpoint, we essentially don't have skin in the game like the carrier does, right? So it's really the carrier's lost experience. The more claims, the more costly claims, the less profitable they are. While that is not true for a TPA, our relationships with our clients really have to bear witness to that, because they do have skin in the game, these employers. So we have to make sure that while we're receiving all these new claims, that we're still managing them like they're our own claims, that it is our own money, because at the end of the day, we have a lot of we have a big fiduciary responsibility there. So from our standpoint, it's going to, I think this presumption, especially in the heavy hit areas like New Jersey and Florida and New York, is going to mean a lot more claims are going to get filed. They may not be expensive claims. Somebody mentioned the low cost, especially California's doing that already. We're seeing that too. But they're going to have, the experience is going to be significant. And I think, like, if I don't know if I'm dating myself, but if we remember the mold is gold claims, right? Some a few years back, I think every certain period of time, somebody's laughing about that, right? There's always going to be something new. We wouldn't have a petitioner's bar if something wasn't going to be new. We just have to make sure from a employer standpoint, our clients, we're making sure that we're protecting them as much as possible by knowing how to adjudicate that the law around essentials, presumptions, understanding what defenses are possible. Is this a probable exposure versus a possible exposure, community exposure? So we have to be, as much as a carrier who has skin in the game, the TPA has to think like that, because it is our clients' money at the end of the day that we're paying for this. But more importantly, it's our clients' employees who are going to be injured. So we really have to balance providing quality medical care to our injured workers, sensitivity, and at the same time understanding that there's a cost behind all this. It's not, it's taxpayers, but it's, in certain cases, pooled monies that are formed from taxpayer bases, carrier, and we handle a lot of programs up to a certain self-insured retention, maybe $200,000 to $300,000 to $500,000. It is somebody is paying for this, so we need to be as fair, pragmatic, and careful as possible. Because while it is not the same skin in the game, we will quickly go out of business if we don't think like that.
Okay. Excellent. Thank you for that. And Tammy, Alice represented the carrier perspective as well, but I do want to give you a chance. Is there anything that you would like to add in terms of your own unique position as a carrier?
Yeah, just a couple of things. I agree exactly with what Alice was talking about, but every carrier is different, every TPA is different, but in many cases we really face similar situations. Often the TPAs deal with many of the large, often self-insured, high retention accounts. Many of these companies may be able to be more flexible and weather the pandemic a little bit easier than some of the other types of companies. Most carriers will have a mix of maybe large insureds as well as many mid-sized and even small mom-and-pop insureds. Many of these may not make it through the pandemic, or their workforce may look completely different than it was previously. So those are things that as a carrier I think that we deal with. I think one of the important things from the carrier side is that in many instances we're facing claims or increased claims that were not originally anticipated when a policy was written as a premium was determined. So those are some kind of unique things that maybe we have not had to deal with so much in the past. And so we may see claims that will be covered that may not have ever been in the past or ever anticipated. On the flip side of that, also, we as a carrier, we're collecting premium for a type of employer that anticipated having these employees at work. And all of a sudden, they don't have their workforce there. So that's something that we may have to deal with in the future also.
Excellent. Thank you very much. And we are drawing close to the end of the hour. We have about 10 minutes left. And Teresa warned me that I had a very aggressive schedule to get through today. But I think it's all been good. Teresa, I am going to direct the last few questions to you. And I think in the interest of time, I'm just going to put all three of them out there and then give you an opportunity to comment while we do have time. And of course, going back to my roots as a pharmacist and my involvement in discussing, with your pharmacist, Dr. Paul Peak, and others about formulary considerations. So my questions are, one, your estimate of what you think pharmacy drug-related expenses may be. Two, do you think the country is heading in the right direction? So much attention being focused on the vaccine or the potential for vaccine. And then lastly, do you see other therapies that may be equally important to vaccines, similar to some of the things that we do with regard to the flu each year? So Teresa, I'll hand it over to you.
Wow, those are a lot. Okay. You can hear me, right?
Yeah.
First of all, we know that it's probably about 2% of our claims that are really severe intensive care, or we've actually had some death claims that are very, very tragic from this. And we know that, early on we saw the hydrochloroquine hit where people suddenly were filling prescriptions for, 200 pills, just following in the president's footsteps of taking it as a precaution. We didn't want to see that. So we worked with you, Phil, and your team to say, hey, let's put some limits on that. Let's not just let everyone get it. And I credit my team because they were right on top of it. They knew right away when that was happening. And these were not even people who had COVID claims. It was just anybody who had a workers' comp claim wanted the medication, which is ridiculous. And I think since then we've learned a little bit about that drug. But what I would say about the formulary is, first of all, we don't know a lot about the consequences of COVID. It behaves differently in so many different circumstances. And those that have had severe disease, we have no idea if they've been on a ventilator for a period of time, what the consequences of that will be in the future. And what will happen to those lungs and that heart and that brain. I mean, we're seeing cases of memory loss right now and dementia and things like that where, we're not used to handling those types of things in workers' comp. So, and they're just popping up very irregularly. And so we don't know what the drug consequences might be that will be needed to treat the sequela of COVID-19. So estimates on that, I think it could be a lot larger than we think, because even those with mild disease back in April, we're seeing the symptoms reemerge 3 months later. And probably it never went away, right? So how do we know what's going to happen with this virus? We really don't. Are we headed in the right direction? We don't know. I think we need a lot more valid testing going on. We know that the testing that's occurring in this country is only 30 to 60% valid, meaning it renders false positive and false negative. That's a concerning number to me, and that's why the CDC has gone to symptom-based strategies and not testing. And then lastly, I would just say everyone has their hat hung on there's going to be a vaccine. Vaccines take years and years to develop for good reason, because vaccines using live or killed virus can have consequences in the body. And in my experience, about 30% of the population is not very pro-flu vaccine. If you think about the yearly vaccines that we ask the public to receive. So knowing that, I don't know that vaccines will be the savior that everybody thinks, because I'm not sure that the public will adopt a vaccine the way we would hope they would. However, I do believe that the first to market for like a Tamiflu, a drug that quickly treats this virus, will be something that will skyrocket. And what will be the consequences for workers' comp? Will it be that if you had a COVID claim, then we're stuck paying for that on a yearly basis? I hope not, but we just don't know. But think about the dollar value of that kind of thing. And when it comes to market, you know, hopefully John and Dave are right that it'll have some federal assistance and some coverage, but there could be huge financial consequences to that. And that's the thought I'll leave you with, Phil.
Very good, and I appreciate that, and I especially appreciate the comments regarding Tamiflu. I think that is something that I haven't heard anyone else talking about yet, so I think that's a very important perspective to have on this. So thank you, and thanks to all of the panelists. As folks registered for the event, we gave them the opportunity to pose questions to all of us in advance. We are down to the last 4 minutes, so I think we have time to bring in one question. And we have alluded to some of this, but I still think that it might be good to elaborate. And I think for this particular question, I'm going to go first to Dave Wayner as a regulator, and then Teresa, bring it back to you. And it's a fairly open-ended question. I remind you we're down to 3 minutes. Dave, where are we headed in the next 1 to 2 years, in your opinion?
Well, Phil, politics, emotion, and reality all intersect on this issue. States, as many of you have read, are facing multi-billion-dollar deficits. So they're going to have a lot of challenges ahead of them. There's definitely a lot of moving parts on presumption. It potentially opens the door for employees with the flu or suffering a heart attack while working from home. I think we'll be talking about presumption in the years to come.
I agree with you.
And I would just add, just from the medical perspective, Phil, I believe that we are 1 year out from being out of this COVID-19 conundrum that we're in the United States. So I think we'll have, you know, another many months of dealing with this virus and the waves, as so to speak. We're not through wave 1 yet. So I think there's a lot more consequences that we can't even begin to imagine yet.
Excellent. Teresa, thank you. Dave, John, Alice, Tammy, thank all of you so very much. I personally got a lot out of this today. I tremendously enjoyed this, enjoyed working with all of you. For those of you that submitted questions, and we obviously did not have time to get to them, we will be following up with you. More to come on that. And Mike Cirillo, I'm going to hand it back to you to close us out today.
Thanks, Phil. Thanks, team. Really, I just want to start with a thank you to Phil and the panelists. I think there was some great dialogue that went on and some really valuable insights that were surfaced. Who knew how much dialogue there could go? And I think we could have expanded this to be 3 hours and still be at full pace, full bore. So thank you, everybody, for your insights. You know, for anybody that's in the audience that has questions or wants more information, I would say don't hesitate to reach out to your myMatrixx resource. There's also, we will post this video along with others on the mymatrixx.com website. And I also invite you to go to the Express Scripts outcomeseries.com website, where you'll be able to see more resources that were surfaced from the virtual summer series. And you know, finally, I'd just like to thank the audience. I think your participation, I hope you derive value from this, but your participation is as critical as the panelists here, because we know we're talking about the right topics and we know we're trying to be there to help for you. So I'll just say thank you to that. And ask everybody that you stay healthy, stay safe, and really take care of yourself. So with that, that concludes our panel for today. Thank you.